Hi everyone, Tony here. Welcome to mini lecture chapter 13 and 14. And so today we're going to be diving into some really interesting aspects of how we learn and relearn skills, especially when it comes to using both sides of our body. We'll also touch up on how specific words or phrases, which we call verbal cues, can make a difference in learning these skills. And so for chapter 13, the learning outcomes that I will be covering is discussing the difference between symmetric and asymmetric bilateral transfer. And then for chapter 14, the learning outcome I'll be discussing is defining verbal cues and giving examples of how they can be used in skill learning or relearning situations. So let's start with something called bilateral transfer. It's a fancy term, but think of it as kind of a skill sharing between the two sides of your body. And there are two types here, symmetric and asymmetric. So starting off with symmetric bilateral transfer is like having a mirror image effect. If you get better at a task with your right hand, your left hand also picks up the skill to a similar level. Picture learning to play the drums. Both your hands improve together. Asymmetric bilateral transfer is the second type, and it's more of a one-way street. It's what happens when your dominant hand, say your right hand, if you're right-handed, takes the lead in learning. So when you practice throwing a ball with your right hand, your left hand gets a bit better at it too, but not as much as the other way around. This concept is super helpful in physical therapy, like helping someone who's had a stroke regain movement. So now we're going to move on to chapter 14, learning outcomes. So let's talk about verbal cues. These are short, snappy instructions that can really help in learning a new skill or getting better at an existing one. They're like those little reminders or tips that click just when you need them. For instance, if you're learning to do a perfect squat, a trainer might say, push the ground away with your feet. That's an external cue, focusing on what happens outside your body. It's usually more helpful than an internal cue, which would be something like bend your knees more. And these cues are also super useful in relearning skills, especially after an injury. So imagine if someone learning to walk again after knee surgery. A physiotherapist might use cues like use your heels first, then your toe, to help them regain a natural walking pattern. So whether it's playing sports, recovering from an injury, or just picking up a new hobby, understanding how both sides of your body share skills and how the right words at the right time can boost your learning is really valuable. It's amazing how our bodies and brains work together in learning and relearning movements, right?